Good morning. It's a pleasure and an honor to welcome you all here today, and mostly to welcome Mayor Gray, and thank you for being here.
Thanks. Well, Susan, thank you so much, and I want to thank everyone for being here with us this morning. Dr. Pollock, Dr. Humbaugh, Dr. Stanton, and everyone who's up here, and the kids. Thank you all for being here. Many of you are working, so many are working diligently and so hard to bring this issue to our community's attention and in many respects to the nation's attention. Gun safety is a concern that we all share. And the Ask campaign, Asking Saves Kids, is a really remarkably effective way to save lives. I'm going to read the proclamation, and then I'm going to turn the podium back over to Susan. And this proclamation has a number of whereases in it. And sometimes I abbreviate those, but today this proclamation deserves every single one of them. And it reads this way: Ask Summer. Whereas more children in the United States die from being shot than from cancer, and whereas 1 in 3 American homes with children has guns, many of which are stored unlocked, loaded, and accessible to children, and whereas a simple strategy of keeping guns safely stored, both at home and in cars, would prevent accidental gun injuries and deaths, and whereas safe gun storage would also help prevent suicides and prevent the theft of guns that are later used in homicides. And whereas the Ask campaign, Asking Saves Kids, encourages parents and caregivers to add one more safety question to conversations before their child visits other homes. And that question is there an unlocked gun in your house? And whereas the Ask campaign brings together all Americans concerned with the welfare of children, including gun owners, to ensure that guns are safely stored. And whereas summer is the season when children typically spend more time at the homes of friends and family. Now therefore, I, Jim Gray, as Mayor of Lexington, do hereby declare the summer of 2018 as Ask Summer in Lexington. And now I will turn the podium back over to Susan, and you're going to introduce Dr. Humbaugh, right? Thank you so much.
Thank you so much.
Yeah.
I really appreciate it.
Now let me hand this to you as well.
Oh, okay.
That's the appropriate
Thank you.
thing.
Thank you very much. I just wanted to thank you, Mayor Gray, for helping us keep children safe.
Hold this for you?
Sure.
Okay, I'll do it.
I wanted to thank you again and to introduce Dr. Humbaugh from the Health Department, who is here because the Health Department is trying to help us do these things already.
Thanks. Thanks a lot, Susan and Mayor Gray. So as a pediatrician, I understand the importance of protecting our youngest generation. As you've heard, about a third of American homes have children that are also exposed to guns. And children are naturally curious and don't really understand often the hazards that firearms present. Unfortunately, about 1,300 children lose their lives as a result of firearm injuries each year in the country. So as you've heard, the goal of the Ask campaign is to get parents to ask the question, is there an unlocked gun in the home? And they need to ask that to themselves at their own homes, and then to families where they're at homes where their children may play. And if the answer is yes, then gun locks and lock boxes are simple solutions. Unloaded guns should always be kept locked away with the ammunition stored separately so that children cannot lay their hands on them. At the Lexington Fayette County Health Department, Our hands home visitation staff routinely ask new parents the questions about if they have unsecured firearms in their homes. And if they do, families receive free gun locks so they can secure those guns and keep them out of the hands of young children. Similarly, our child health care consultants also provide gun safety education to parents and families and to child care centers throughout the community. And for more information about any of these programs or about gun safety, please visit our website, lexingtonhealthdepartment.org. Thanks.
Thank you. I really appreciate the efforts that HANDS and the child care health consultants do every day. And I just wanted to say, too, that for those of you whose press goes beyond just here, that in health departments across our state, the HANDS program is trying to make this happen, too. And now it's my pleasure to welcome Dr. Ryan Stanton, who is an emergency room physician and the director of EMS. We know that parents want to have this happen, but sometimes they do have access to guns, and people like Dr. Stanton see what happens when that happens.
Good morning. I guess we've now reached full breadth of height differences in the microphone usage. I got my girls here, and I remember growing up myself in Atlanta, Georgia, and then Johnson City, Tennessee, and going around and finding the closet and finding my dad's .38 Special and handling it and playing with it and showing it to my friends and things like that. And luckily, you know, he never kept it loaded, but I was a kid, I didn't know that. And it's one of those things that kids are curious, kids are learning, kids are around the house and playing with things, and so there never is too safe when it comes to guns. 89% of accidental deaths of children from firearms happen within the home, and most of those are guns that are just sitting around. And so putting it on top of a shelf, putting it somewhere else for that protection is not something that's going to keep the child safe. We need something and methods and actions and education that's going to keep those guns locked up and safe from children they're going to be around, because there's very few things that I see that are more heartbreaking in the emergency department or in EMS services that are more heartbreaking than the injury or death of a child from whatever reason that may be. And people talk about what we do in the emergency room and how you get through the death and sickness and injury, and honestly it becomes average for us, except with a child. With a child, the whole emergency department will go silent for the rest of the shift. Nobody talks, nobody does anything else. You do your job, but everything gets quiet. You don't have that collegial relationships and talking and laughing and things that typically happen on a work day. Everything is completely quiet because of a loss of a life that had so much more to gain and so much more to do. And so if there's an opportunity that we can do to help educate, to ask to keep our kids safe, that's what we want to do. If that means locking them up, that means the things that all Dr. Humbaugh talked about, keeping the ammo separate, not keeping one chambered and ready to go in case somebody breaks into the home. You know, there's simple things we have to do every single day at our homes to keep our children safe, and we should do everything we possibly can to do that and to protect the most precious thing that we have on a given day, and that's our children. Thank you.
Thank you. So really, you've heard from everybody. It's my job also to review the deaths of children in this state that die from a variety of causes. And when you've even seen one child or several children who have died this way and the pain that their families have, I think we can prevent it. Most families want to do the right thing. And when we gave away gun locks a few years ago, everyone that we talked to who wanted a gun lock had guns at home that weren't secured but wanted them to be. So that's why we're encouraging everyone to ask, because parents want to be able to keep their children safe. And I'm also including asking about where they keep their guns in cars, because I've seen that a lot of people who do a very good job of keeping their guns safe at home when they're in their cars haven't yet thought about how do I do the same thing in my car. So I just wanted to encourage that. And we're going to encourage everybody in our health departments, all the physicians, all the families, all the moms, all the survivors, all the friends of ours, all the suicide prevention people. We're all asking that people consider, are there unlocked guns in your house? Because the simple act of locking them up keeps them safe. And it's not enough just to hide them or to educate kids and hope they won't handle them because they're curious, as you've heard. So I just want to thank you for being here and encourage you to ask all your friends to ask if there's unsecured guns where your children play and to lock them up too and keep all our children safe. And thank you. And thank you, Mayor Gray, for the proclamation.